without further ado, I'd like to introduce our presenter today, Dr. Dean Fixsen. I'm thrilled about our experience that we're going to have today. We're going to meet and talk about district pieces this morning, and then this afternoon, some of us are going to focus on some state implementation. So I'm just thrilled about our day today. I've heard Dr. Fixsen present a couple of times, most recently at the Global Implementation Conference, which was a new conference that they held this year in Washington, D.C. And it was fabulous. A few of us from our office were able to attend, and we're so excited about implementation science and what that means. So Dr. Fixsen is a co-director with Karen Blase of the National Implementation Research Network, or NERN, and also of the State Implementation and Scaling Up Evidence-Based Practice Center, or SISM. So he is from the University of North Carolina, Chapel Hill, and we are just thrilled to have him. So I will turn the time over to Dr. Fixsen.
Can you hear that okay? Good. Thank you very much. It's great to be back in Utah and back with the UPDC. Did I get that right? I hope. Yes. And very nice to have all of you here from districts, because this is where the real action occurs, we think, in education. So it's nice to have the turnout here in Utah. And this, we will talk about some of the things we're learning about districts and how districts work with schools, and schools work with teachers, and teachers work with students in order to achieve the outcome. So I've given away the entire premise of this presentation. So but it's building those kinds of chains is what it is all about. As Heidi said, we're from the National Implementation Research Network, so I am here on behalf of all the people named on the screen here, because none of this gets done, as you well know, by individuals, even though in education and human services we tend to single out people and put them into hero status because they have done things in spite of the system in which they work. And what we would like to do is have teams of people who are doing fantastic things because of the system in which they work. So, but here we are, the National Implementation Research Network. There are just a small number of us. But we get the opportunity to work across all of human services, education included in that. And so what we find is that what we're learning in one area, we can apply to the next, and what we learn in that one, we can bring back to education. So we are on a very steep learning curve when it comes to some of the things that we're about to talk about this morning. The really neat thing is that as we're learning this, we're learning also, once the lesson is learned, and maybe it took us 3 years, 4 years, 5 years to learn that, now we're getting these things done in 1 year. So once the lessons are learned, we can start compacting the time, and this is good news for all of you. So some of the lessons learned is what we will also talk about today. I'm going to, I was not quite exactly sure how you all, how many of you there would be, and but now we have a nice sized group, so this is my favorite venue. So what we're going to turn this into is a discussion format. So I'm going to present a piece of this, and then we're going to stop and have a bit of a discussion about that before we move on to the next piece of this. And so so as you're thinking, we're talking about some of the introductory kinds of things. Think about how this either already is applying in your district. We're already doing this kind of work. We don't call it that, but so having some of those examples that you would like to share would be a very good thing. Or, you know, that thing you talked about, we tried that, didn't work at all. But let's talk about that as well. So to the extent that we can have this be a group learning experience, because when you're saying those things to me, I get to learn. So we'll have this be a two-way street. So, and if you guys are pretty good in the early stage of this about having this kind of back and forth discussion, then we will take a break. If not, we may have to go all the way to noon. So you decide. You and your bladder can decide how you like that Okay? We can always choose our own behavior, but we cannot always choose our consequences. So, all right, education. Huge, complex, full of all kinds of bears and all kinds of caves everywhere we turn. And that school bus every day pulls up, all those kids get out, and they go to classrooms, and something happens. It's going on right now while we're having this meeting, as a matter of fact. So one of the challenges that we have is, how do you change the system when you are participating in the system? And so that's one big challenge that we need to be thinking about as we go along here. So how do we build anew while we're still operating what exists? And so that is another big frame for the discussion that we're going to have before we take our break mid-morning. So what are the kind of goals? We want to improve student outcomes. I mean, that's the thing, right? We don't always behave that way, but that's it. We want to make full and effective uses of a variety of evidence-based programs, other effective innovations. We now have, fortunately, thanks to our research colleagues, a whole list of these things that are pretty effective. The range of problems that we have in education are this big, and you have to watch over here, the evidence-based approaches are this big. So you kind of see there's a bit of a mismatch here. So some of the things we're going to talk about is, in the absence of this little slice over here that really does have an evidence base behind it, what can we still do to pursue the first goal here? And really, the goal of all of us in education, it's those student outcomes. We want kids who know how to read, write, do arithmetic, and have good relationships, and on and on. So take responsibility. Establish system capacity. Part of the problem that we have, and we will talk about this in more detail, is that we really don't have the capacity in current education, and again, not picking on education, this is true of human services generally. We do not have the capacity to achieve the goals that are set forth in the first statement. This has been true since I got into the field in 1967, and is still true today. So it's time for us to start doing things a few ways differently. Implementation science really is born out of the experiences that you all have had, that other people have had in education and other human services. Excuse me. But current methods for supporting evidence-based programs are not all that well developed. But in spite of that, people have done remarkably well in a school, a classroom, a district, and for as long as those people are around, things have gone really, really well. But what happens when those people leave, or that particular funding stream ends, then lots of head nods, you all know what happens next. We move to the next thing, and that part's gone. So we have ended up with these islands of excellence. But not to take anything away from the islands of excellence, because 10 years ago, we did not have very many of those. 10 years ago, there was considerable doubt whether anything could ever change in the way that we would hope to have it changed. And there was considerable doubt that we would ever be able to have schools function differently with teachers, so teachers could function differently with students and actually produce the kinds of outcomes that we were looking for. So these islands of excellence have been fantastic exemplars of what could be. Now we know, though, that they don't last long, that we have sustainability problems. And they're very difficult to spread because it's kind of a happenstance. It's a happy coincidence of things that led to this island of excellence. And so it's very hard to replicate that. It's hard to do that again and again and scale it up. But implementation science, implementation best practices come along, and here now is another layer of things. This is the new thing. And we don't want it to be the shiny object that is another little island that goes away in a few years. This needs to become part of our way of work in human services, and certainly part of our way of work in education. And if we could pull this off, and we collectively here in Utah and other states This is where the sea of change will occur. We're going to get past the islands and into this more larger scale change. A sobering thought came to us a few years ago. All organizations and systems are designed intentionally or unwittingly to achieve precisely the results they get. So when we look around us and complain about, well, we're not getting, why don't we have kids learning math? Why don't we have kids attending school regularly? Why do we have them? Well, it's because the system is producing that. Now, unwittingly. We did not design it this way. It just is the way it is. And there's this whole thing in other fields called legacy systems. Computer science is full of this. Some people say I'm full of this, but here, why is it that they have these thousands of lines of code in this particular way of doing word processing? Well, part of that is version 1, part of that is version 2. Well, this is version 25. But which parts of those old things that are left over are still functional? And nobody knows. I mean, really, nobody knows. So they have to go through this whole transformation process to sort out the functional things from the non-functional things. And we will talk more about that as we go along. But we are stuck in human services and education with these legacy systems. Why is it we do the things that we do? Why do we have these particular units doing these particular things? Why? I mean, and you go around and you ask people, it's one of our favorite things when we go into school districts, well, why do you do it that way? Well, I don't know, it was that way when we got here. Well, who's been here the longest? You go find that person. Where did this come from? Gosh, let's see, we had the superintendent of schools, they had their 10-point plan. That was in '87. I think this is the 1 point left out of that 10-point plan. But that's the best rationale you can kind of come up with. So there's no functional reason for it to be there. So legacy systems are the things that we all live in. It's what we're used to. It's what we accepted when we joined up. It's what we have engaged in thoughtlessly. And now we need to start rethinking some of this. But this, when we read this, and to this day kind of gives me chills up and down my arms when I think about this, these outcomes that we don't like, we are producing these things on a regular basis in these systems, and systems, as you all know, are very powerful. So changing systems is not for the faint of heart, but we'll talk a bit about that. What are the products of this system that is there? Here are the NAEP data that have been collected. For those of you who can't see in the back, on the far left is 1971. So here are 40 years worth of literacy data. As you know, the Institutes for Education Sciences, they do their, every few years, sample of a few 100,000 kids in each of these age groups. But what else in American society has remained this stable for 40 years? 40 years ago, I mean, Nixon was president in 1971. I mean, that's a long time ago. The U.S. Department of Education didn't exist in 1971. It wasn't until 1980 that the U.S. Department of Education was even in existence. 1971, federal government had a very minimal role in education. Now they have a significant role in education. I mean, you just go through all, Evans space programs didn't exist then they do now, we have lots. Think of the reforms that have come and gone. Where are the impacts of that? And they aren't there. So this flat line, and you know in medical terms what a flat line is? It means you're dead, right? We have to enliven this system. We have to get past the legacy system. We have to find a way then of making change and making the change then become the new standard. So that's the challenge that we have, and that's a challenge that you all have taken on. And here in Utah, you guys are making good progress already. So implementation science, we want to focus a bit on that. You have your version of that on the table over there. If you haven't picked it up, folks here in Utah know how to do things right. See, I have one copy of this left out of the 4,000 that we printed originally. There's been another 400,000 that have been downloaded from the internet. Until I came here a few years ago, I'd never seen one in color that had all this. I had no idea. I thought, wow, that's pretty cool stuff. You know? I didn't know. I went home, printed one off on a color machine just so I could have one too. So I'm going to take this one with me. So implementation science is new. It's not new in the sense of people trying to do this, trying to learn this. We started back in, our first implementation failure was in 1971, so that was the big stick upside the head, getting your attention sort of thing. And from that point on, we've really been pursuing this, both in a practical way as well as from the science part of it. So you're going to hear a lot about what we've learned in the last 40 years or so. Implementation gap. Here we are. We have these evidence-based programs, practices. We have the good things that you guys have created. You have your own evidence in your own schools and districts that these things work. But these are not being used as intended. We can go from one classroom, one district to another, ask them about absolutely, we're doing RTI. My gosh, we were doing RTI before anybody even said RTI. We've been doing this well for years. Okay, great. You go in and you start asking about their data systems and how they adjust their instructional practices in keeping with the data. Well, maybe not so much. So we're not using these things as they were intended. And so consequently, we are not getting the outcomes that are the promise of all of this. When we do use them as intended, then we have difficulty sustaining them. Again, it tends to be too much person dependent. As long as that superintendent is there, that principal is there, that teacher, that group of people happen to be there, they help each other. But when 2 or 3 of them leave, then the whole thing kind of goes away, or the funding for that particular thing goes away. Then the program leaves as well. And then, even if we get past those 2 hurdles, how do we do this on a scale that will impact all of children in all of schools? We want to move all those needles, as much as I don't like many of the needles, but we need to move them all. And so how can we do that? I mean, it's really fundamental change in education is what you are all about. But this has to be done on a scale. That's where we have to get past the islands of excellence and into the sea of change. This is where it has to be all kids, all the time, every school, every teacher, every year. Here is the current state of affairs. Rand Corporation did an excellent study of a few thousand schools. They had the comprehensive school reforms and I think there were like 12 on the list. They asked for volunteer schools, and schools said, yes, we're very interested. Matter of fact, we want to do number 7. Another one said, we'll do the 3rd one on your list. So they volunteered, and they chose the comprehensive school reform that they wanted to make use of. In the evidence base for that particular comprehensive school reform, in generating the evidence, every teacher was trained, and every teacher had follow-up coaching in the classroom. So that was part of how the evidence, and that's why schools were choosing to do this. They wanted those outcomes. When Rand, though, looked to see, well, what did the teachers, or what happened in these schools in the next 3 years? Well, fewer than half of the teachers got some training, not even all of the training that had been prescribed by the developers of the comprehensive school reforms, and fewer than 25% received some kind of follow-up support in the classroom, and again, not at the intensity. So consequently, when they were looking, Rand Corporation studied the schools and saw in years 4 and 5, fewer than 10% of the schools were using these reforms as intended, so they're using them with fidelity, and consequently, the vast majority of students did not benefit. So here, why are we oscillating for 40 years around this mediocre mean in literacy for these 9-year-old kids? here's part of the reason. It's not the evidence for the evidence-based program. It's not for lack of knowing that there's an effective approach that could be taken. It is the lack of support for those interventions, those new ways of work at the school and at the district level. And so this was a wonderful and sad example, but it explains a lot about why we are not making the kind of progress that we would like to make. Some of our colleagues in the UK, Trish Greenhall and her group, but also building on the work of Hall and Board and others, have come up with these 3 categories of activities to support the work at school district levels. So there's the letting it happen, helping it happen, making it happen categories. We like these kind of categories because suddenly it helps make sense out of many, many things in the field. So the letting it happen, this is where researchers do the research, they publish the research, it's in the journal. Hey, it's up to you guys to, you're educators, you have advanced degrees, you're smart people. Go read the literature, read the study, and take it back to your school, your district, and do it. So I've done my part, now it's up to you to do your part. Well, after 40 years or so, we got people said, well, you know, that's not working too well. So how about we try something else? Now we're in the helping it happen group. And now, so it's producing nice, colorful things, you know, like this, summaries of research. You get it handed out to people. We do training sessions like this. We have brochures. We have, you know, lots of neat kinds of websites to share information. Lots of electronic stuff that's available to us today that we didn't have before, but a great way of getting the information out. But the whole point is to get it into the hands of you all who are at the district and school level so that you then can make good use of it. But again, we are now providing the information, and it is still up to you to figure out what does this mean for us and how are we going to get this accomplished in our schools and in our districts to produce student benefit. Well, that is probably the most prevalent form of attempts at implementation right now. That's a whole dissemination category, dissemination of information category. And again, very, very useful, very helpful to get information out, have people know that there are alternatives to the ways that they're currently doing things. Here are people to get a hold of. Here's some useful kind of tools that you might try out. So again, not to take anything away from either one of these things. The problem is that they are just not very effective when it comes to generating student outcomes in the way that we're talking about here, doing it over and over and over again and doing it on a useful scale. The third category that Trish Greenhall and the others identified is making it happen. And this is not heavy-handed. What this means is you're making the very best use of implementation science to create the conditions under which these new ways of work will be used and used well and used with good outcomes. And no longer are you responsible for this, it's now an implementation team. And implementation teams come in many forms, but this is our summary term for all of those forms. But the implementation team is now accountable. So there's a shift here. So it's not up to you, and you guys have jobs as near as I know, and you're pretty busy day to day, and this, how you can find out what all needs to happen, how would you figure out how to put this into practice? I mean, that's a lot of work, and people just don't have time for that. So we're creating these teams. They are the ones who will do this work. Now we have people who do have the time to do exactly what is required to have this happen in schools and to generate those outcomes. So it's a shifting of accountability to somebody else. It's no longer up to you. You're now the recipients of this new level of support. We'll talk more about teams as we go along. As we did the review of the literature and looked through a few thousand studies, but the very best data were about these things. And all of these things are things that are insufficient. So what we know most about are things that are ineffective. And why do we know the most about things that are ineffective? Because when scientists go to study what's going on, they study what we're doing. And what are we doing? We're doing ineffective things when it comes to implementation. So, they can't study what's not there. So this is why we have, it took us a little while to kind of get that part. But again, each of these things are important. It's just when people have tried to use this as the way of doing their work to get the science and the best practices into education, into classrooms, into schools, into districts, this has not worked very well. So all the dissemination we talked about, the training, one-shot training, spray and pray, train and hope, sit and get, I don't know, you guys have lots of words for all these things. Laws, mandates, requirements of one kind or another. Again, important things, but when that's what you only do, it does not get you where you want to go. Funding, incentives, organizational change, we've all been through so many of these things. So you centralize, and then you decentralize, and then 10 years later you centralize again. Anyway, so, but out of this, over and over and over again, somewhere between 5 and 20% though of people in that, putting it out on you, you figure it out, it's up to you to get this work done. 5 to 20% actually go do it. And they go do it with fidelity and with good outcome. So part of what we saw in the RAND study, they ended up with 10%. Many of these studies, you end up in that 5 to 20%. And we're going to keep coming back to this because somehow or the other, about 10% of the people get it somehow up front. They are able to go back and do it somehow on their own. And so this 10%, give or take a little bit, shows up again and again and again. But we cannot be, again, that's why we're stuck here on this mediocre mean in the NAEP scores, because that 10% is there for a while and then they're not there. So here's the formula for success. So effective intervention practices times effective implementation practices equal effective outcomes. But notice that's a multiplication problem. And you all being educators, you know what happens if any component is 0, then the product is 0. Thank you. Sometimes I do that with other audiences. God, what would that mean? So I love education audience. So but notice though, effective interventions. If we have a really good way of implementing things, we've developed this whole structure that we're about to talk about, and we have excellent implementation. We have implementation teams that are skilled, doing their work well, and we give them an ineffective method that we want them to make sure every teacher does in every classroom and every kid is exposed to this. What kind of benefit are we going to get out of that? We're not going to get anything. We're going to have a well-implemented something that doesn't work. So that's in nobody's best interest, and it's a huge waste of resources. So the first thing we want to do is make sure that whatever it is that you are satisfied. And again, knowing that we have this big range of problems and only a few that are actually on the What Works website or clearinghouse and a few of the other websites. But there are things that you guys are doing in your own schools, your own districts that you're convinced of that are effective and that you want to scale up in your own district. So, but that effective part is something to pay attention to. Effective implementation practices we'll talk about, but the thing with this multiplication really gives you, if you have implementation is done well, you get disproportional impact on outcomes. And some of the studies, it's up to 12 times greater return than if you have ineffective or some of these kind of do-it-yourself approaches that we were talking about earlier. Interesting in education, the study that just came out, you may have seen already, and from the Department of Education, But they were looking at prevention programs in schools, 5,800 schools. On average, I mean, this is the part that blew me away, they had 9 prevention programs that were being tried out in every school. I don't know what 9 times 5,840, that's a heck of a lot of innovations going on in all of these schools. 7.8% of those were evidence-based. There was some evidence that if you were to do this innovation, one of the 9 that they were doing per school in 5,000 schools, there was only 7.8% had any evidence that said if you were to do this, it would make a difference. That's less than 1 per school. So thinking about that formula for success, you need to start with something that's effective. And here, 7.8% had a chance of making a difference if it was done well. So this is a big issue. I was frankly surprised when I saw this, because this is 2004, 2005, in the middle of the whole No Child Left Behind. Enough time had passed, enough resources had been invested. I would have guessed this would have been many fewer innovations and a lot more on the evidence side. So anyway, food for thought. So the actual benefits that accrue at the classroom level, at school, district levels, comes when you have effective interventions that are effectively implemented. That's the formula for success. And one study after another, large national studies in education, in health, in social services, in mental health, in substance abuse, that's all the citations at the bottom. If you're outside of that one quadrant, you are not going to get benefits. As a matter of fact, of course, if you have an ineffective program, all you're going to get are poor outcomes. But sometimes it's not just poor outcomes, it's harmful outcomes. And so this is not a benign thing. Sometimes we are doing damage when in fact we are intending to be helpful. But on the effective side, without the help of effective implementation supports, what we end up with is inconsistent uses of the intervention, if it's used at all, and it's not sustainable, and again, we end up with poor outcomes. But to see this in one report after another, across all these human service fields, health, education, welfare, it becomes pretty compelling that we need to make sure that we're up there in that upper left-hand quadrant. So, as you might guess, since I just spent about 5 slides on this, the big point that I would like to have you go away with and not forget after today is this. An intervention is one thing. We're going to put all the interventions over there. Implementation is another thing. We're going to put it all over there. These two things could not be more different, one from the other. There's a science for interventions. There's a science for implementation. You can do more and more research on the interventions, and it's not going to get you to implementation. As desperately as some of our NIH colleagues would like to have this be, that they could just do one more study, and if they could get that there, but they're back there where they're going to hand it off to you, right? And you're going to do this, and that's demonstrated time and time again not to work. So interventions, implementation, very different. We talk about this like serum in a syringe. Serum, has chemical compositions, has buffers in it, has active inert ingredients, has all kinds of things. And syringes, I mean, made out of some form of plastic with really sharp needles, handled by really skilled people, if they're going to poke me with it anyway, because I hate those things. But here, you can't have one without the other, right? What are you going to do with the serum if you don't have a way of delivering it? So each needs the other. And what does the hypodermic needle? It's sharp and handled well by a skilled professional if there's not an effective serum to put in there that's going to cure you of whatever. So it's this symbiotic relationship that is there is different. Everything is different, and yet they are interdependent. So write that part down, circle it on your PowerPoint, do whatever, and when you go back to your office and you do your autocorrect function and your Word document thing, whenever it comes up, type in intervention is the prompt. And anytime you type intervention, it comes up intervention and implementation. So you cannot avoid. When you think of one, you got to think of the other. Think of one, you got to think of the other. But they're different, but you got to have them both if you're going to be successful. Global Implementation Conference, Heidi mentioned. We had the first one last year, 800 people from around the world, and had 42 of the 50 states represented, along with 25 countries, I think. We left them with the charge of going back and starting to form their own local, regional implementation groups where they can start getting together, forming collaborations, and who knew? People are actually doing this stuff, so it's pretty neat. The next one of those will be in 2013, probably again in August, I'm sorry to say, and Washington, D.C., which is a nice venue. So, so lots was learned at the GIC, lots been learned from the review of the literature. So let's talk a little bit about making all this happen. First of all, let's go back though, because this would be a good time for a little discussion. So we're just talking about the foundation. What's the premise for all of this? Why do we care about implementation? And maybe it's that one. So any discussion about that? Any of the data here that you'd like to talk more about? Anything that has caught your attention? Something you'd like to ask questions about? Remember, your breaks depend on these discussions. Yes, ma'am. She saved everybody, just so you know.
Thank you, Karen.
The new heroine of the group.
I'm wondering if you could give us a reference for any of the studies that showed that effective implementations are 12 times more impactful?
There is a reference, it's, and you'll find this easily. Durlach, D-U-R-L-A-K, and Dupree, capital D-U, capital P-R-E, and I think it's 2008.
Thank you.
You're looking at an old guy with a poor memory, so I may be off. The names are right, the date may be off by a year or two. But but they summarized a whole bunch of literature that had been summarized partially in the 90s, again early 2000, then they updated all of that. But they were looking at, I don't know, 1,200, 1,300 studies that had been done, but they're like a degree. Oh, yes, ma'am.
Okay, well, what we've discovered in Salt Lake District is, especially with, let's say, literacy instruction, that a little bit of this and a little bit of that, and SFA and Excel, our students weren't getting the outcomes that we needed to have, especially with the diverse population, mobility, and all the other factors. So we've gone to asking our teachers to use a math basal and a language arts basal with fidelity to implement this across our district.
So I'm talking about fidelity and making use of programs that are available, making sure that it's done with fidelity though in Salt Lake.
In fact, in our district, that's being called the F word.
But fidelity is now the F word.
So it hasn't been an easy shift or an easy, and I won't use the word mandate, but it hasn't been easy for all of our teachers to get on board with this, because the research that we've done shows that this is a very powerful and impactful thing for students, especially when they're moving among our schools, and that, you know, that these basals we're using are research-based and they are meeting the needs of our kids.
So fidelity is important, hard to get teachers to buy into it, and
So in order to get full implementation has been
yes. And I'm glad you brought that up, and we will spend some time on that here shortly. But the buy-in process, how do we help to bring about change? And especially this kind of change. And this affects everybody, teachers, students, parents, I mean, at the most basic levels. but then how the schools are run, how districts are run, what does the state do to support this kind of work? All of these things come into play. So it's the ripple, it's the pebble in the pond, and all the ripples go everywhere. Yes, ma'am.
Well, and I think when you talked about coming up with the implementation teams, what we talked about is, given our limited resources, how do we come up with that team so that it's not people already doing a million things and then congratulations, you're on this team, you get to do a million more. And so how do you make good decisions on
Good.
what goes and what responsibilities get moved around? That's really challenging.
It is very challenging. So how do you create an implementation team when when everybody is already busy doing everything that they're doing? Congratulations, you now have new responsibilities in addition to.
Gracious when we've done it to them before.
Yeah.
We might
So
kill them off,
we'll talk about that next as well. So, but those are good things. Let's move on here for a little bit and get at some of these issues you're talking about. So, and in the monograph is a whole bunch of research and people's experience, and that as we were looking through the literature, reading these studies one after the other, we went through a couple thousand studies, and for any study that had any kind of data on an implementation related thing, here's what we did, here's how we did training, here was a coaching part, here's a data system that we use. If they had data on that, maybe it was an opinion survey or something, but at that point we didn't care. If there was anything to do with an evaluation of that made it onto our list. So we started making up lists of things. Here were things that facilitated it, and here were things down the whole list that got in the way. And we up front said that whatever it was that this was in this article, we were going to believe it. And so, but now you end up with, well, A is on this side, and A is a facilitator, and A is getting in the way. Well, but we're going to hang on to this notion that they're both true. And so how can A be true and not A be true as well? So this, we made all these lists. And after a while, we said, we've got to come up with a way of making sense out of all of this, because to just regurgitate all of these lists would bore everybody to tears, including us. So we kept sifting, sorting, and finally came up then with the implementation framework. So these are the common features. And again, we were looking across a whole range of things, all of human services. We were looking at business applications. We looked at agriculture. We looked at, whatever anybody was trying to do on purpose, we were looking at their data. So here's how it all ended up making sense. Innovations, evidence-based programs, whatever you want to call them, but they're all innovations. And innovation is something that is new to you. The next district may have been using this for the last 5 years, but if in your district you're using this for the first time, that's an innovation. It's new to you. So it doesn't mean that it's new in and of itself. So it's new to you. Anything that you're trying to do that is a new way of work, people have to learn how to do the new way of work. And so how do you learn how to do new ways of work? Well, it starts with selection and training and coaching. I mean, these are the things that, again, in the literature, as we are sorting all of these things now into different kinds of piles, this is how we were making sense of these long lists of things. And we'll come back and revisit these things as we go along. The interesting thing was that this was sufficient to produce pretty high fidelity behavior on the part of practitioners and educators, mental health professionals, substance abuse counselors, whatever. But it didn't last long. Well, why were they not lasting long? So we started sorting through all the ones around sustainability. And it turned out that sustainability was highly associated with the organizational side of things. So if practitioners have new ways of work, organizations have to develop new ways of supporting practitioners doing the new ways of work. I mean, once we got the idea, it made total sense, right? Everything is clear in hindsight. but we just struggled with this until we finally figured out, okay, and what are then the dimensions on the organizational side? The ones that were sustaining these use of evidence-based programs, the use of innovations for a long period of time, they all had a decision support data system. They had information coming in that supported their decisions about the thing, about selection, training, coaching, and about the use of the intervention by the practitioners. What were the practitioners doing? What were the immediate outcomes for kids and families or whoever it is that they were dealing with? But they had data on that. But notice it's decision support data system. The data system was not there like we have so many that, well, you collect the data and it goes to the data warehouse and I don't know what happens to it there, but it's not used for anything. So it has to be immediately accessible, it has to be relevant, has to be reliable, so that you will base and can base decisions on this. And it has to be useful for teachers, it has to be useful for the principals and administrative staff, has to be useful for people at the district level, and when you sum all this up, it's also useful at a state level. So everyone benefits from having this. Everyone can make better decisions based on the kind of information that's collected there. Facilitative administration. In the organizations that had changed to support evidence-based programs well, those administrators, managers, principals, staff, they understood that who is it that produces education benefit? It's teachers and the staff who are directly interacting with those kids, on those students on a day-to-day basis. Principals don't do that. I don't do that. Most of you, I suppose, don't do that. We're not interacting with kids. We are not the producers of education benefit. So what is our role? What's our job? Our job is to support teachers doing that. So what do we want teachers to do? Do we want them spending a lot of time on paperwork rather than interacting with kids? No. Do we want them spending a lot of time in meetings, rehashing this, that, and the other thing instead of interacting with kids? No. If we've gone to all the trouble to create competent teachers, we want them interacting with kids every minute of every day as much as possible, knowing that you still have to do paperwork and I mean all of those things are there. But facilitative administrators find ways of cutting all of that stuff back to the bare minimum. Data systems. When that interacts with the facilitative administration, the agenda for a meeting, and we've seen this pre and post, before the evidence-based program, before the implementation part of that kicked into gear, the meeting was all about what problems this kid had. And they had some good data on that often. And they talked about that for 55 minutes, and then the last 5 minutes, they talked about what they might do differently tomorrow to help solve that problem. After all of this got into place and facilitative administration was there, you were allowed 5 minutes at the beginning of the meeting to quickly review the data and to admire the problem. After that, it's all about solution. We're done admiring the problem, let's move on. What are we going to do? And so the action planning was the thing on the agenda. But these are the things that facilitative administrators, you're looking for the next opportunity to provide more support for teachers doing the best possible job. What do they need? Talking to them, I mean, it changes everything. You talk about school culture, district culture change, there is the fundamental ingredient right there. Not everything can be solved within the school, within the district, so you always have somebody you're reporting to on up the line. And so these systems interventions, without implementation science kind of feeding into this, without doing this on purpose in the way we're talking about here, it usually ends up with us doing a lot of complaining. Well, you know, here comes another one of these compliance things. It just takes up tons of time, we spend all of our money there, blah, blah, blah. But we don't really take it anywhere, we just complain about it. But that's something in the system out there that's impacting our ability to do our work here. There has to be a place we can go with that. There has to be a way to resolve those issues. We'll talk more about that. So the organizational side is there in support of the intervention and the implementation. You can only do these competency drivers well if you have the support of the administrative side and the support of leadership. Leadership, there's technical leadership and adaptive leadership. This is another one where we spent a lot of time. It probably took us 10 years to figure this out. And finally, Fixsen and Lori published a study that said there's technical kinds of leadership and there's adaptive. And suddenly, all of our lists, we now had a way to make sense of that about leadership. Technical is more like management. The problems are pretty familiar. The solutions are pretty readily available. You can kind of take things apart, assign it to different people. You work on this part and that part. We'll come back next Tuesday and we'll put it all together and we'll figure out how to change whatever to resolve this issue. So, and not that that's simple. It's not to say that these are just easy problems to solve on the technical side. But building a nuclear reactor, for example, is pretty complex. But it's a technical issue. Now, engineers know how much concrete to put in and how many blah blah blahs. Well, I should have used something else since we're closing all those down. Adaptive side, though, this was the part that really got our attention because this is the part we puzzled over where to put this stuff. We kept trying to get it into the facilitative administration, and it was not a good fit. But the adaptive leadership piece of this, it's when your budget has just been cut by 1/3. Anybody here, I don't know, probably haven't had that experience, but other states outside of Utah, big problem with the economy. You just had the death of a child in one of your programs. You just had, there are issues that come along that you don't even know sometimes what the problem is, so you have to figure that out. But you know something's wrong. So you have to puzzle through what is the problem, and then when you have this fuzzy thing that is now sort of being defined as a problem, what are you going to do about that? And again, so instead of taking things and kind of doing this reductionistic management side of things, you're really getting people together and bringing in your collaborators, bringing in the teachers and parents and anybody else who might have something to say about this. And this is a very different style of leadership, but it is leadership at its best. This is the transformative stuff that goes on. And all of you in this room, I would guess, have faced exactly these things. But the adaptive leadership, you're not sure what the problem is, so you get people together to help define that. You're not sure what the solution is, you get people together to find, we're going to try out something, see if it's going to work or not. So kind of like, but you're into a real longer-term problem-solving kind of approach at that point. And we'll go into all of that. But the Fixsen and Lori, Heifetz, and Lori, Laurie, 1996, might be 7. But fantastic article. It's in the Harvard Business Review. Integrated compensatory. There is not one thing around the outside of the triangle here that you don't do already. Every organization hires people, orients, trains people, supervises, if not coaches people. You always have a data system having to do with money, if nothing else. You always have administrators who are trying hard to help things in a positive direction. We're always complaining about the system, if not taking messages up there, and certainly the leadership is always there. So it's not about any of those things. It's the best practices associated with these things that are the real key. We're going to talk more about that shortly. Now, all of these things are implementation drivers. And these things are the drivers of implementation, and these are the inputs for implementation. So we're talking about our wall over here. So if you want the outcome for implementation drivers done well, that outcome is your fidelity assessment. So we're back over here, the F word. But we call it performance assessment, so now it's the PA word. But this is the outcome. So if we are selecting people well, training people well, coaching people well, they are going to more often than not meet our fidelity standards. And if they're not, then we need to change how we're doing selection, training, and coaching. Even though the performance assessment is about the teacher, let's say at a school level, it really is the reflection of the coach. So when we look at all of the teachers that a coach is coaching, we sum up their fidelity scores, and that's the outcome score for that. That's a measure of that coach's coaching ability. So you see how this starts to roll back? We're assessing the teacher, but the responsibility is with the implementation team who's making sure all these things happen. So with fidelity, though, comes the next part. Why do I keep hitting that button? If we have fidelity, then we have a real good chance of having consistent uses. Remember, inconsistency was one of the bad things on that little chart with the 4 boxes on it. And if we get consistent uses of effective interventions, what do we get? We get reliable benefits for students. And so the performance assessment piece of this is where innovations and implementation come together. Implementation done well results in high fidelity performance, and it's high fidelity performance, though, of the intervention. So it's not just some abstract thing, it's doing this reading program well, doing PBIS well, doing RTI well, doing the math program well. So that is where these things come together. And if you don't have fidelity, you don't have the link between what you're doing in selection, training. We can engage in autistic behavior down here, entertain ourselves with all of that, and wonder why we're not getting the outcomes up there. That's probably inappropriate. But fidelity, 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 fidelity. And some people do think of it as the F word, but it is the thing that is missing, and we'll look at some data on that here shortly. Questions about that? But it's this link. Fidelity is the outcome of implementation drivers done well, and it is the input to interventions done well. So it's an output of one, and it's the input to the other. Questions about that? Okay. Either you're tired, or I did a better job of explaining it this time. But we're going to harp on this fidelity thing for the next couple of hours. Staff training. So now we're going to talk about some of these implementation drivers. Staff training is training when you have pre-post assessments of the knowledge and skills of the trainees. If you don't have pre-post assessments of your knowledge and skills of the trainees, you have just had a meeting. But let's not call it training. Training is there to have people learn about the intervention. See, this is where it shifts from this more generic, amorphous sort of thing. This is about learning how to do RTI. This is learning how to do your literacy program. Are we teaching this in training? And how well are we teaching this in training? These are some of the early data, as you can see, 1976, where we were training cohorts of people for residential care programs back in the day. But you see the pre-scores, you see the post-scores, but the important thing here is, this again is not just about the trainees. I mean, we're doing pre-post testing of their knowledge and skills. This is really feedback for the trainers. We have to get better at training, so every one of our trainees was at 80% or better when they left. And we were trending in that direction, and too bad I don't have the next several sets of data, because it went above 80%, and here 30 years later, 90% is actually the criterion that we're shooting for that. So what you find out about the trainees, though, helps you do training better. Okay? The other thing about this is, when people leave training, these folks that we have not done so well with on this particular chart, we can tell the coach, we got this far in training, but here for this person, you really want to pay attention to these things because we did not really help him learn those skills very well. So in your coaching, you want to pay attention. So there's a feed forward function that's built into this as well. When you start putting training, coaching, performance together, you've all seen this, I'm sure. If you've ever heard me talk about it, there's now lots of other data, fortunately, from other fields, but here we are with education. But here's training done well. Theory, discussion, and demonstrations, and training, and practice and feedback. The practice with feedback part is absent from most training. So if you have that in your training, congratulate yourselves right away. Doing that to criterion is the next thing that is absent, so that it's not just doing it one time. The two of you talk to each other, practice this thing. We'll give you 15 minutes, you're done. Oh, good. How'd that go? Fine, thank you very much. No, this is organized in a way that you're constantly assessing, have they learned the skill? And if they didn't, you go back and re-practice. And some, as Rob Warner says, day one training is done when day one skills are learned. And so we're sometimes there at 8 o'clock at night, and still with that last person trying to get day one finished.
Did they get a bathroom break though?
We will in about
No,
1
I
second.
said, did they?
Oh, did they? Yes, we had many bathroom breaks. There are lots of stories I could tell you about that, but training done well. Here we are back with the 5 to 10%. So, and Joyce and Showers looked at a bunch of training, research on training. They summarized this. They did a whole big meta-analysis. So this is not one study. This is a lot of studies that have, and on average, you get about 5% of the teachers, 5% of the whoever it is that you're trying to teach something to, who actually go and then use it in the classroom, use it in the place where you want them to be. What happens when you add coaching? It goes from 5% to 95%. So when teachers leave training, everybody leaves training excited, you're happy, I mean, you go back and you start doing this stuff. Oh my gosh, what were those words again? And what was I supposed to do? And you don't feel very comfortable. And I just heard the other day, I haven't seen the study yet, but by the end of the first week, over half of the people have stopped trying, and by the end of the first month, you're down to your 5 to 10%. I mean, that was startling. I can't wait to see that study. But we have here, though, in these data, a choice. And this is when we're talking to administrative people and decision makers, federal level and state level. What do you want here in your state? What do you want here in the U.S. Department of Education? Do you want to invest a lot in training, which everybody does, and have 5% of the result in terms of benefits to children, families, and others, or do you want to have 95%? You get to choose. What are you going to pay for? If you want to pay for coaches and competent coaching, not just somebody named that, but you have the manual already written here in Utah on competent coaching. So, but it makes a difference. See, this is the thing about implementation, why sometimes you get up to 12 times greater results. I don't know what that is, but that's a lot, between 5 and 95%. Of course, here we are Here I am giving you some theory. We're going to do a little discussion. What do I expect that you guys are going to do? None of you are going to go back and do one thing useful with any of this information. So I don't expect any of you to go back and implement anything any better than before you walked in here. So unfortunately, I'm engaging in ineffective behavior up here. But that's why I wanted you to remember that one thing, 4 slides, emphasis, circle it, So at least you'll know something. So that knowledge thing at 10%, that's what I'm counting on. So speaking of breaks, why don't we take one there and we can get into the next part of this. We can kind of shift gears a little bit. It is 12 minutes before 10 and I will start sharply at 10 o'clock and hopefully you will be back by then.